some fun. Tune in late at night or tune in the sun. This is TFM. Get ready to rock. From AM to PM. Come on. Let's talk.
TFM 95.4.
Let's talk.
Live on TFM and the TFM Facebook page. This is the live feed of TTV. Let's talk.
Hello and welcome to the Midday Update. Here are the latest stories from our newsroom. The Ministry of Health today announced the registration of 12 new coronavirus deaths in Oman. The death toll has now touched 349 in Oman due to the virus so far, the officials at the Ministry of Health informed. They also extended their deepest condolences to the family of the deceased. Officials at the Ministry of Health today also announced the registration of 1,660 new coronavirus cases in the country. 1,364 of the new cases are Omani nationals and 296 for non-Omanis, bringing the total number of coronavirus cases registered in the Sultanate to 71,547. According to the Ministry of Health, this number also includes the recovery of 47,922 patients and 349 deaths. The ministry urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health, as well as staying at home and not going out unless necessary. It's time for a quick commercial break, but stay tuned as we have more latest updates your way. Welcome to TTV, you're watching Midday Update. The Supreme Committee tasked with tackling developments resulting from coronavirus pandemic in a meeting yesterday decided to complete lockdown of all governorates of the Sultanate from Saturday, July 25th to Saturday, August 8, 2020. The meeting held at the Interior Ministry to follow up developments of the pandemic and measures of prevention of its propagation was chaired by Sayyid Hamoud bin Faisal Al Busaidi, Minister of Interior. The Supreme Committee also banned movement and announced the daily closure of all public places and commercial outlets during the lockdown period from 7 p.m. to 6 a.m. Police patrols will be intensified and command and control points will be activated in the daytime during the lockdown period, said a statement issued by the Supreme Committee, which also banned all types of assembling of gatherings, including Eid al-Adha prayers and traditional pre-Eid souk trading activities, Hafta, as well as any exchange of Eid visits among families or group gatherings to celebrate the Eid. The decisions were taken in view of the considerable rise in the number of people being infected with COVID-19. They are a necessary measure to protect individuals and society against infection with the disease, to ease pressure on health sector and enhance its capacity to handle the situation. The committee prayed for the Almighty's divine protection of all people against all harms. The main committee of the moon sighting announced the sighting of the moon for Dhul Hijjah 1441H. Hence today, Wednesday, is the first Dhul Hijjah and Friday, July 31st, will be the first day of Eid al-Adha. The Ministry of Awqaf and Religious Affairs also confirmed the vision of Dhul Hijjah Hilal on Tuesday, July 21st evening in the Sultanate sky. The committee met under the chair of Sheikh Abdullah bin Muhammad bin Abdullah Al Salmi, Minister of Awqaf and Religious Affairs, and membership of His Eminence Sheikh Ahmed bin Hamad bin Sulaiman Al Khalili, the Sultanate's Grand Mufti, Khalid bin Hilal bin Saud Al Busaidi, Under Secretary of the Ministry of Interior, Dr Muhammad bin Abdullah Al Hashmi, Judge at the Supreme Court, Sheikh Abdul Jalil bin Muhammad bin Ahmad Al Kamali, Judge at the Supreme Court, and lastly Sheikh Muhammad bin Salim Dahman Al Nahdi, Judge at Muscat Court of Appeal. The committee stated that it has received confirmations on sighting of the moon to declare the start of the month of Dhul Hijjah 1441. On the occasion, the Ministry of Awqaf and Religious Affairs extended their congratulations and greetings to His Majesty Sultan Haitham bin Tariq, praying to the Almighty Allah to return this and similar occasions for years to come on His Majesty the Sultan with good health, happiness, and a long life, and on the Omani people and all Muslim countries with progress and prosperity, and to protect all against all harms. Zawaya Group, one of the Sultanate's leading contractors and developers focused on highly complex projects, announced the handing over of the new Doha Khaleej private school, new premises in Airport Heights, Muscat. We are pleased with the amount of work completed in this short time frame. This milestone marks a major accomplishment, and we look forward to seeing the school officially open its doors for the coming academic year. We couldn't have done any of this without a supportive client and our team-oriented professionals, said Sheikh Osama Al-Khalili, founder and chairman of Zawaya Group. Leading up to today's milestone, Zawaya Contractors has managed to hand over the building 6 months ahead of the delivery date. Doha Khaleej private school includes approximately 20,000 square meters of new construction of 7 floors that combine administrative offices, labs, 100 classrooms, and recreational areas such as playgrounds, 2 swimming pools, and a multi-purpose hall, along with state-of-the-art amenities serving both students and faculty members. Locals and expats in Oman have been reminded to follow the rules put in place by the government to stop the spread of COVID-19 owing to the strain that is being put on the medical system due to high case numbers. Dr. Zaid Al-Hanai, a consultant on pediatric infectious diseases at the Sultan Qaboos University, said that everyone in the country needed to abide by the rules for the number of cases in Oman to come down. Now we're talking about 1,000 to almost 2,000 cases a day, which is a really high number. It is putting an immense strain on the healthcare system. The ICUs across the country are full, and the number of daily deaths is now averaging 10 people, and it might go up further, so we have moved in the wrong direction, the doctor explained. Al-Hanai, who is also an associate professor at SQ, added that the course of the pandemic is hard to predict. During the month of Ramadan, I think there were a lot of more family visitations, and that contributed to the spread of the cases, but people did not anticipate it would be so much. When we are with family, we let down our guard and we are in our comfort zone. So we may not think of this kind of situation with the same sort of care we do when we are out shopping or we are at work. We need to take a lot more precautions as far as family visits are concerned, and there are a lot more things we need to bring under control. When asked about if not following the rules put in place could lead to an increase in cases over Eid al-Adha, and Al-Hanai said, it is very much possible that we will see another spike or increase in cases, and that is why I think we have to prioritize safety and minimize visits. Eid greetings can be done over the phone and over video conferencing. If we do not pay attention, this could get even worse. A medical team from the Royal Hospital has successfully performed a rare surgery on a 40-year-old patient with heart defects. The Royal Hospital issued a statement stating that, in a qualitative medical achievement of the National Centre for Cardiac Medicine and Surgery at the Royal Hospital, represented by the Cardiac Electrical Unit, an Omani medical team at the centre was able to perform a rare electric catheter for a patient suffering from a complex deformity of the heart from birth, currently 40 years old. According to the report, in the last period, the patient suffered from an upset and rapid heartbeat. The difficulty of the catheter was that there was no veins that delivered blood directly to the heart as a result of the deformities and operations previously performed. This necessitated a specific catheterization and through the aorta, unusually for this type of heartbeat disorder. The procedure was performed by an Omani medical team led by Dr Ismail Al Abri, a consultant electric of cardiac and pediatric cardiology in the center, in cooperation with technicians of cardiac, nursing, and anesthesia. In addition to that, we have Dr. Ismail joining us today, who is going to tell us more detail about this rare heart disease which has been performed lately. But again, we'll be right back in a short break, so stay tuned as we'll be having Dr. Ismail joining us right after this break. As I mentioned earlier, we have Dr. Ismail, who will be joining us to talk a bit more about this rare heart surgery that has been successfully performed in Oman and tell us how it went. Thank you so much, Dr. Ismail, for joining us today. Dr. Ismail, there is no sound from your end. Yes, Dr. Ismail, yes, I can hear you now.
Can you hear me now?
Yes, Dr. Ismail, it's loud and clear.
Yeah.
Thank you so much for joining us today.
Thank you for having me today on your show, and to talk about this, the successful catheterization that we have performed recently.
I would really like to congratulate you on performing such a rare heart surgery in Oman and your team that has been involved in this surgery. Doctor, could you please tell us about the condition first? What was the condition like?
Okay, so in this particular, procedure, catheterization that we have done recently, the patient was suffering from very rapid heartbeats that affected him recently. Actually, this patient has been having a problem, a congenital heart problem from the time of his birth. He's now 40-year-old, so he underwent multiple surgeries in the past abroad. But recently, his conditions got complicated, and then we had to intervene to help him and to control his heart rate, which went crazy fast, so that it affected his general health.
Thank you, Dr. Ismail. Now, talking about this surgery, what was exactly the procedure that you had to perform?
Yeah, so just for our viewers to understand what we are talking about, and our listeners also, as everybody knows that this is just to show a heart model here. I don't know whether it is clear to you. Everybody knows that the heart has 4 chambers, we call them. So the blood comes to the heart from the body, and then it gets pumped to the body again after it goes to the lung, get oxygen, and comes back to the heart, and it gets pumped back to the body. So in this particular patient, unfortunately, when he was, God created him only with like half a heart. So the other half, this half was not, created. And so he was living all of his life with this only problem. And of course, because of this problem, he underwent the surgeries in the past where they had to divert the blood coming from the body directly to the lung. Okay, and then comes back to the body for pumping. Now, what he had is that he had an increase in his heart rate, and then we could record this by the what we call it a 12-lead ECG, as it is shown here. Okay, and his heart was going crazy fast, so we had to control him. Of course, we tried initially with drugs to do this, but that unfortunately failed, so we had to intervene by more advanced procedure. And normally in those type of procedures, we go from this vein here to the heart, okay, and then we try to treat the procedure. But in this particular patient, this vein was not existing, so there is no access for us to go to the heart. So we had to find another route. So we went like from another vein that was unusually, we go through. Okay, so it was like a long catheter and a long procedures to go and reach the area that we have to treat. But fortunately and luckily, we eventually succeeded, and then we managed to cure his, tachycardia and or increase heart rate, and then eventually he left home in a good condition.
Once again, Dr. Ismail, congratulations on such a successful heart surgery. And the way you explain, it does look very challenging, having a certain brain not present in there and then going through the other way. I'm sure it's a challenging task. Dr. Ismail, could you tell us how long does this procedure take?
See, and we are doing this kind of procedures in a routine basis, in almost daily basis. They normally take like 1 hour to 2 hours, okay? But in this particular patient, because it was challenging to reach, so it took us around 4 hours and a half to get into the right place and deliver the right treatment. Okay, so it was a little bit challenging.
Dr. Ismail, could you tell us what is the unique aspects of this surgery? We can see on our display, I think these are the pictures during the surgery that you took. Could you please explain to our viewers as well?
Yes, this is what we call a 3D. We have the most advanced, technology that we are using, and we call this as a three-dimensional recreation of the heart. And then we can see here how that heartbeat is going very fast. So that's how electricity moved inside the heart, and it is going on the wrong way and it's moving very fast. So as you can see here, the patient is going into like a heart rate of 200 beats per minute. And then during the the successful period, you can see the movement of our catheter. The heart, luckily, the fast heart rate. Of course, what the challenge is that we are working is pumping, but we have to reach the right place and deliver the treatment while the heart is moving and pumping. We cannot stop the heart to go and and fix the tachycardia and then go out. We have to do it. So it's like you are shooting in a fast moving object. So that's also another challenge we had. Okay, but again, as I said before, luckily it was a successful alhamdulillah procedure. Yeah.
Dr. Ismail, I was asking you, what are the unique aspects of this surgery before, we showed this 3D model. What is so unique about this surgery?
So what is so unique is that it is very rarely done in the world, because the first thing, the condition itself that the patient has is quite rare. Like it presents in, in probably, I would say, one in or they can have this type of defect in the heart that with this type of surgery. And actually, many of them, they don't live to this age. Okay, but our patient was lucky that he had the right intervention and he was small, and then he could have a good health. Okay, so the first patient itself is the heart disease here, and of course of that will be challenging because there are not so many cases being done in the world with a similar, with a similar scenario and similar problem. So the experience worldwide is quite limited in this. So that was quite a challenge for us. So to be honest, initially we wanted to invite a team of experts from France, but due to the lockdown and the difficulty of getting people from abroad, we decided to do it ourselves, our local team, which was initially challenging, but with the spirit of the very good team that I have and the support of administration, we could manage to do it successfully.
Dr. Ismail, how often this surgery has been performed in Oman, and how rare is this particular condition in Oman or across the globe?
Well, see, as I said, like this as what we call an electrophysiology procedure or catheterization is a routine procedure, but to do it in a such unique heart with no access that you can go to the right place easily, this is quite rare. In the literature, probably there is no cases that done with a similar scenario. Maybe there are some similar cases with different scenarios, with different complexities, but in such patients, or maybe it has been done, not published, but I haven't come across. Of course, because this case is quite rare, we have to publish it and show it to the world as well, that we have done it and we are capable of doing it. So the complexity itself is very rare. And the combination of complexity and having this procedure is also quite rare.
Talking about the complexities of this surgery, Dr. Ismail, what are the challenges that you face or you faced while performing this surgery?
Okay, so of course the challenges is, the most important challenges is the experience. So do something nobody probably have done in the past, and for yourself it's a challenge, and then you have to you have to work and you have to think about it, you have to plan it very well. And of course in this particular patients we have done an MRI of the heart first. We have identified all of his anatomy correctly. Okay, so we were very prepared to do this case. And the other challenges, of course, of having the technical support, again, experienced people that can help, that can identify, that can analyze those signals and, help you in treating such patients. Again, we are quite young center, okay, with the terms of experience in cardiac electrophysiology. Probably, I mean, we have started probably 4 or 5 years ago to do more complex procedures, but with those challenges, we decided to go ahead and, and accept the challenge and treat these patients because he was in real need and he couldn't wait.
Thank you so much, Dr. Ismail. It's time for us to take a very quick commercial break, but you all stay tuned with us as we are still in conversation with Dr. Ismail. Welcome back to TTV. You're watching Midday Update, and we still have Dr. Ismail in session today. Dr. Ismail, you said that in terms of if this surgery has been performed in Oman before, and you said there is no evidence so far because this kind of surgery needs to be published and needs to be put out in front of the rest of the people to learn and to adapt. Has this surgery been done across the globe, and what has been the success rate?
In those particular patients with very complex heart disease, of course, the surgeries are quite rare, or this kind of intervention is quite rare. Although they have lots of problems for their, from the arrhythmia perspective or from their heart rhythm management perspective. Okay, but having it with this combination, I haven't heard that it was done somewhere else. Okay, and then also we have tried to search the literature and see whether anybody has published a similar, case, which we haven't seen yet. So, of course, we're going to publish this, as you said, to the rest of the world to show them that the way how we did it, and then probably somebody else can learn from it and can, if they are faced with a similar scenario with a similar condition, then we will. Of course, we have to show how we have done it and how it was successful.
Thank you, doctor. You just mentioned that this particular surgery, because it's so rare and so complicated, this took about four and a half hours for you to perform. How long does it take for a patient to recover after such a major surgery?
Yeah. So luckily, of course, this we have done it without without the need to open the chest itself. So we have done it through the veins that goes through from the patient's leg. Okay, and then we have inserted the catheter. So there's actually no opening of the chest or no opening of the patient, and this allows, of course, the patient also to recover fast. In our particular patients, he only required 1 day to recover after the surgery, and the next day he was able to leave the hospital with a good health. So this is also another advantage that this kind of intervention is done without the need, to open the heart of the patients or to open the chest of the patients, and which allow a faster recovery time for the patients. And of course, he can enjoy his life. He can enjoy his life with family. Within 24 hours, the patient was at home. Actually,
within 24 hours, the patient was at home.
Yes. Yeah.
Oh yeah. Wow, that is incredible. But how long will it take for the patient to actually start doing the normal things that the patient was doing earlier? Do you recommend the patient to actually be bedridden for a certain time, or
actually within a week he will be back to his normal life. He should be practicing his whatever he was practicing in the past within a week. And so the incisions that we made in the veins are very small, so they can immediately heal, and the patient can go back within a week to basically to his life without any problem.
Dr. Ismail, I'm just really curious to know what kind of lifestyle do these patients adopt, or patients who have these certain conditions, what kind of lifestyle do they adapt to?
Well, this is an interesting question actually, because talking about the patients with what we call congenital heart disease, or when they were born, with, as I said before, with some malformation in their heart, there are quite vast, diversity of them. So some of them are Some of them live normal life like any other people, especially after their defect has been corrected. But there are other patients whom they will not tolerate low oxygen, so they cannot, for example, live in places with high altitude. The flying for them sometimes are challenging, and some of them require oxygen during flights. Okay, and some other patients also whom we unfortunately we cannot correct their abnormalities. Some of them are so complex that no surgery can be done for their life. They will not be able to live for long, and some of them also, even if they lived for some for long life, they probably have some complications because their disease complex. Majority of them, the vast majority, more than 99% of they will be fine. As you can see here in the background, now showing our catheterization lab and how complex the signals that we have, and we're dealing with multiple, as you can see, screens that we have to see, and then we have to. These are the types of cables and wires that we put inside the patients during the intervention that we do. Okay, so so it is quite. It requires a lot of course, knowledge and experience to go inside the heart and to map the electricity inside the heart and try to fix the abnormalities. Yeah.
Dr. Ismail, this is just one heart surgery that you have recently performed. We were talking about any other rare heart surgeries that you have performed.
Of course, when we started the service here, as any other center in the world, we have started with very simple ones, with very simple catheterizations and interventions and surgeries. But with time, we have gained experience, we have gained confidence. So, we have step by step, we have to increase the complexity of patients and of the lesion we are treating. And we have gained a good experience. We have treated our patients with even complex procedures, complex surgeries. So it's a matter of time, experience, and trust and confidence. And with this, also, I would like to thank the parents and the relatives and the patients themselves for their for their confidence, for their trust on us, because many of the time, again, when we started the service, most of the patients were going up to do those kind of interventions, and the service was not initially. So to gain the trust, to gain the popularity, for the people, to do those procedures, okay, wasn't initially easy. Time, successes that we one after the other, the people nice things. Now we have also been from from the GCC countries to do it here, and not only that, we have been invited to do some complex also once in other GCC countries. So that's also a big achievement for the heart center.
Right. Dr. Ismail, talking about this incredible journey that you have just explained to us right now in the rare heart surgeries and the challenges that you have placed and the confidence of parents and patients, both you have gained at the same time. How well equipped do you think Oman's health sector is in dealing with such rare surgeries and complicated cases in future?
Yeah, so that's a very good question, and also it gives me the opportunity to thank whoever is behind all of these successes. We are, at the end of the day, we are only operators that do the procedures, okay? But for us to have a successful, procedures, we have to have the right setup of not only of the the missionary type, but also the human resources. We have to have the perfect setup to do those procedures. And I would like to thank the administration of the National Heart Center, Royal Hospital, and Ministry of Health for their continuous support. Actually, as you can see here in the background, and our lab is very well equipped with the latest technology. Okay, we have been doing many procedures like in any other center in the world, advanced center in the world. We have all kind of procedures that you will find it abroad. Okay, in the most advanced, we have the latest equipment, the latest technology, and not only that, in our field of of work, especially I'm talking electrophysiology, it's very advanced. Like the procedures that has been done 5 years ago is outdated. Now we have to do it in the right way, in the new way. So there is always a new achievement. There are always new people who are working hardly to give us more advances in the technology that we use. Like I would say, 10 years ago, the technology that has been used in this type of procedures was primitive. Okay, but now with the advances in nanotechnology and fiber optic connection, the signals that we get from the heart are much clearer, and then we can also have much more successful procedures. And we have all that in Oman. We have an equipped heart center that has all this, and not only that, now we are probably starting those kind of services in the National Heart Center, Heart Center in Sultan Qaboos Salalah Hospital. So this service also will be coming soon there. The hospital is being equipped for this. The both expertise and the equipments are available luckily with us.
Dr. Ismail, in terms of the growth of doctors and specialists and health specialists in the country, how have you been seeing their growth lately?
Yeah, this is a very interesting question and very interesting point that you are raising now. We have like in the past 10 years, a vast increase in number of Omani, especially Omani specialists in very subspecialized areas that even in the world they are very rare people who are working on it. So I would like initially to thank all of the people who are behind this, who are having a very good strategic planning for the health sector of this country. At the end of the day, what matters is the human resources. You can get the equipments, you can buy them, you can, and a very good example of that, I was just telling you that sometimes you think that even like you can bring people from outside, but sometimes to do the procedure. But unless you have your local team here well equipped, then probably it will be challenging. Okay, so having those subspecialized physicians, cardiologists, and other specialties that working in all health sectors in Oman, both in private, of course, and in governments, in Sultan Qaboos University hospitals. There have a massive growth in human resources in the past few years, and thanks, of course, to the Oman Medical Specialty Board. They have been doing a tremendous job in graduating specialized and sending people abroad to subspecialize in a very unique and even like rare subspecialties that, as I said, in some of the parts of the world you cannot find it.
Dr. Ismail, in your opinion, what are the common specialties that Omanis are opting for, and what specialty you think is lacking behind than the other one, and you would recommend the youth, the current generation, to opt for in future?
Yeah. So of course, like in the past few years, most people were likes going into the surgical specialties, into the internal medicine, pediatrics. Okay, so we have now a good amount of people that have been trained on those specialties. But of course, we have an important requirements for anesthesia, for example. Anesthesia is a subspecialty that requires still lots of work to be equipped with human resources here in Oman. So that's a big challenge for our health sector. Okay. And as you can see here, recently, once we had this COVID, outbreak, there has been a massive and tremendous need of people who are, trained in intensive care. So intensive care training also is a very important, and now all the countries in the world are looking for, physicians who can run and nurses who can run the intensive care. So some other some technical specialties, technical supports also, like anesthesia support, anesthesia nursing, okay, intensive care nursing, and all the critical areas are in severe shortage or worldwide. So of course also we are not an exception. We need all to work on this aspect. Probably in public healthcare, we have very good number of Omanis who are working now in quality. Those are also important subspecialties that have been, I would say, like it has been, of interest to people, but now we have good amount of people who are working there. But as I said, anesthesia, intensive care, and of course cardiology, and with all specialties is required. Some rare surgical subspecialties also are in demand to our country.
Thank you so much, Dr. Ismail, for once again joining us on today's session. It was extremely interesting and we learned a lot. And there is so much more respect for all you health providers out there who's actually taking care of both citizens and residents in the country and doing an exceptional job. Thank you so much, Doctor.
Thank you again for having me. Thank you very much.
Thank you for tuning in today's episode. We'll be back again tomorrow at 2 p.m. with more updates your way. So stay tuned and keep watching TTV.